Good morning. My name is Dr. Paul Kershaw. I'm a policy professor at the University of British Columbia's School of Population Health and founder of Generation Squeeze. And today I am launching a new alliance, Get Well Canada, in partnership with colleagues at the Canadian Centre for Policy Alternatives, Think Upstream, the National Collaborating Centre for the Determinants of Health, the Universities of Calgary, Dalhousie University, and at University of BC. Get Well Canada is an alliance to fulfill the promise of Canada's commitment to healthcare, to achieve the transformation that so many of us have been talking about this past week as First Ministers met about healthcare. We launched Get Well Canada now because science shows clearly that we cannot achieve transformation in medicine alone, because medical care accounts for only 1/4 of our health. So long as Canadians can't access safe homes, good incomes, quality childcare, and a healthy environment, the medical system will never be enough to prevent Canadians from dying early. That's why Get Well Canada takes some issue when premiers are claiming that the federal government isn't delivering enough new money for healthcare. $198 billion over the next decade is a substantial investment in getting control of a medical care system on fire. These investments will help us douse the flames and improve access to the health services that Canadians now need. But by resisting calls for even more medical spending, the Government of Canada has retained fiscal room to slow the flow of sickness into our clinics and hospitals by investing where health begins. In programs like $10 a day childcare, the National Housing Strategy, poverty reduction. No one would choose to flee their burning home if the flames could first have been prevented. Yes, we are grateful when firefighters heroically show up when we need them. But preventing fires is much less deadly, less damaging, and less costly. So it is with our health. We must not let investment to treat illness crowd out investments in the things that make us well. Transformation of our healthcare system will not be achieved if politicians only asked, how much more should we invest in medical care to treat those already sick? What proportion should flow through private or public clinics? And how much more should go to pay doctors? Yes, those questions are important, but even their best answers will never be enough to make us healthy. Because the medical care system wasn't designed to create health, it was designed to treat illness after we fall sick. Science shows that governments are more likely to improve life expectancy, reduce avoidable sickness, by growing social spending more urgently than medical spending on things like childcare, housing, and poverty reduction. It's a quintessential case of the old adage that an ounce of prevention is worth a pound of cure. There was a time when our provinces organized their budgets around this evidence. Back in 1976, provincial governments consistently spent more on education and social supports than they did on medical care. Now, the opposite is true. So it's no coincidence that medical care costs rise while access does not, that there are doctors who wish they could prescribe poverty reduction and housing and childcare, but they can't, and that as a result, too many medical professionals are burning out amid long lines of patients needing their care. In response, Get Well Canada calls on governments to reduce pressure on the medical care system and tackle the affordability crisis via one single winning strategy. Canadians get well when we invest in affordable homes, livable incomes, $10 a day childcare, and a healthy environment more urgently than we do in medical care, because these social investments not only reduce cost of living pressures, they promote health and they prevent illness. That's how we can slow the flow of sickness that is demoralizing our health professionals and overcrowding our clinics and hospitals. To better achieve this, Get Well Canada is calling for 3 things. First, better tracking and reporting. The Prime Minister observed in his speech this week, what gets measured gets done. A key indicator for genuine health innovation is the ratio of social spending relative to medical spending, so we ask that Ottawa task the Canadian Institute for Health Information to feature this ratio in its annual reporting. Second, We do need better budgets. Governments should use their annual budgets to grow social investments more urgently than spending on medical care, because that is the best strategy to make Canadians happier, healthier, wealthier, and more resilient for generations to come. And lastly, we do need culture change. Canadians must broaden our understanding of health so that we never again witness a First Minister's meeting where so many leaders overlook that health begins where we're born, grow, live, work, and age. Health does not begin with medical care. Thank you, and you can learn more about the work of our Alliance at getwellcanada.ca.